Hello and welcome to Kidney Plugged In. We have a special episode in store for you today as we welcome back Janeen Tronnes and continue our mini documentary series, A Family's Journey Towards Kidney Transplantation. Janeen is here to bring us up to date on their journey towards kidney transplantation as the search continues to find a donor for their daughter Ava. And she talks about the challenges they've faced as a family dealing with kidney disease during the COVID-19 pandemic. And we continue with our series, We've Got You Covered for COVID, with more tips that we hope will help you navigate through daily activities in these challenging times of COVID-19. And we're here to tell you that the Kidney March isn't canceled this year. It's back and will continue in a new format in 2020. So stay tuned for all the exciting news about 2020 Kidney March and updates on Team Because YuKan that is already in training mode for this year's event. So stick around because it's all next right here on Kidney Plugged In.
We're plugged in, and we've got you covered for COVID. Children and adults with chronic kidney disease and kidney transplant recipients are at a higher risk of serious illness, including COVID-19. The following advice from Health Canada can help reduce the risk of infection or spreading infection to other people. Health Canada is calling COVID-19 a serious health threat, and the situation is evolving daily. The risk to Canadians is considered high. This does not mean that all Canadians will get the disease. It means that there is already a significant impact on the healthcare system. As new information becomes available, the public health risk is continually assessed. People with COVID-19 may have little or no symptoms. You may not know you have COVID-19 symptoms because they are similar to a cold or flu. Symptoms have included fever, cough, difficulty breathing, and pneumonia in both lungs. In severe cases, infection can lead to death. Currently, there is no specific treatment for COVID-19. Most people with mild coronavirus illness will recover on their own. No vaccine for COVID-19 is available at this time. So what should you do if you experience flu-like symptoms? Contact your healthcare provider and/or your kidney healthcare team to ask for further advice. Stay home and avoid others if possible. If you have a medical appointment, call the office ahead of time for further advice. Good information is the first step towards prevention. The Public Health Agency of Canada website offers detailed information on COVID-19 and provides regular updates. We recommend consulting their COVID-19 disease outbreak update pages to learn more about COVID-19 and the steps you can take to protect yourself and your loved ones. Most importantly, before making any decision that could affect your health, consult your doctor. We're plugged in, and we've got you covered for COVID.
Since August of 2019, we've been following the Tronnes family on their journey towards kidney transplantation. Mom and Dad, Janeen and Rich, and their 13-year-old daughter, Ava, have been on a journey towards transplantation because Ava is a kidney patient in need of a kidney transplant. Now, if you've been following our mini documentary series, the last time you would have seen Janeen, I think we caught up with her around February, early in the year. And of course, a lot has happened since then. We're now 5 months down the road, and so pleased that Janeen is back to talk to us, bring us up to date on the family's journey toward kidney transplantation, but also to talk about how they've been navigating through this time of COVID-19 pandemic. So welcome back, Janeen.
2020 has been a very big year for Ava and myself, but it's also, of course, been a very big year for all of us. After 9 years, Ava's doctors felt that it would be best for Ava to be put on dialysis. She just wasn't having any energy, she wasn't feeling well, and even though we'd been using medication, or she'd been prescribed medication for those 9 years, they just felt, okay, let's go to the next step. A catheter was put in early January, and she was put on dialysis. In Ava's case, we were given the choice of hemodialysis or peritoneal dialysis at home. Ava chose peritoneal dialysis, and that meant a few positives, some challenges, that it would be done at home every night for 10 hours. And what it also meant is training for 10 days for both her dad and myself. I think it was very key in any decision when it comes to your kidney disease, is being able to make that decision. And having Ava be 13 and she turned 14 on July 2nd, I think her being able to make that decision, have us and have the doctors provide her information and support is key. But I think ultimately it falls on her and how it affects her and affects her body and affects her energy and mood and all that. So I think that's key. So there were a couple of hiccups along the way, very rare, but in Ava's case, a month after the catheter was put in, she had one of her fallopian tubes wrap around the catheter, which didn't allow for dialysis to happen. And so after a little bit of investigating, they figured that out. And then we went home and had a month of good dialysis, and it started happening again. Well, come to find out, it was the other fallopian tube as well that got caught. So anyway, it's all been smooth, knock wood. It's all been smooth since March, and we continue on dialysis and hope that it continues as well. With every form of dialysis, there are some positives and negatives, and peritoneal dialysis is no different. The positives that we found for Ava have been that it's much more gentle on your system. As it's done every night for 10 hours, there's no roller coaster of up and down. It's kind of continual. It's heavily monitored by the peritoneal dialysis staff. And one of the other positives is that she's able to do it at home. Her dad has actually taken her on a few overnights or even a trip to Soyuz where they were able to set up the machine. It takes a lot of pre-planning, but she's able to actually kind of live a little bit of a normal life with it, even though it happens every night. Some of the negatives are that it is every night, and so, you know, the times where she's tired or us as parents are tired, it's the last thing we want to do, but we have to go through the process of setting up the bags, which has to be an extremely sterile environment, and we have a checklist of things that we have to do to make it all happen. So, but she's pretty easygoing with it all, and, you know, she knows how to. She's been watching us do it, and she sees if there's an alarm, she knows how to handle it, and so it's been overall a good experience.
We're Kidney Plugged In, and we've got you covered for COVID. The situation regarding COVID-19 continues to evolve here in BC and across Canada. As part of the response to this continuing global health pandemic, patients in BC will be able to continue to obtain refills of their regular prescriptions at pharmacies. This is an effort to avoid non-essential physician visits and free doctors to treat COVID-19 cases. Pharmacists are committed to ensuring ongoing patient access, so make sure to speak to your pharmacist about what an appropriate supply of medications looks like for you. If you need to visit your local pharmacy, make sure to observe key health and safety guidelines, including observing physical distancing recommendations, wearing a mask, and if possible, arrange to have someone pick up medications for you. Do not visit a pharmacy in person if you're experiencing symptoms or are self-isolating. Instead, tell your pharmacy to arrange to have your required medications delivered to you. Patients with compromised immune systems or who have an increased risk of more severe outcomes from COVID-19 may need a longer supply of medications to reduce the number of visits to the pharmacy or clinic if they do become sick. Check with your local pharmacist about the appropriate supply of medication for your circumstances. Plan ahead when ordering supplies in the event that some supplies normally stocked by your local pharmacy may be depleted. Remember not to stockpile medications. Doing so could be harmful to the drug supply and could put others at risk. The College of Pharmacists of BC recommends no more than a single month's supply, but patients should speak to their pharmacist about the personal health situation, and their pharmacist can recommend an appropriate supply of medications. The College of Pharmacists of BC is working closely with the Ministry of Health and other partners to support the response of this new illness as part of BC's health system. The situation is ever-changing, so for more information on pharmacy's role in helping fight COVID-19, please visit bcpharmacist.org/COVID-19. We're Kidney Plugged In, and we've got you covered for COVID.
Hi Kidney March family. My name is Laura Fleming and I'm the manager of Kidney March and Signature Events. Welcome back to those of you who have participated in the past, and welcome to our 149 new family. Kidney March is going ahead in an exciting new format. We're going to walk within our communities and are asking you to commit to walking 70 kilometers from August 10th to September 10th, which is our day zero. Then we're walking 10 kilometers per day for the 3 days of Kidney March, which will total your 100 kilometers. This is a suggested minimum distance to keep all of you safe, as there won't be pit stops every 2 to 3 kilometers, medical staff, and the support vehicles. You will have access to a platform for tracking your 100 kilometers. We're going to get super creative and have fun. Over the next few months, you will train, get to know each other, and then connect virtually for the 3 days of Kidney March. Our crew is essential to Kidney March, and they are going to work hard to bring the best experience to you possible. We can sleep in tents in our yards or build a fort in our house to mimic the 3 days at camp. You can walk with your kids, pets, grandparents, grandkids, partners, and spouses while practicing safe physical distancing. We will raise awareness and funds for all of our kidney patients who need it now more than ever. There will be a virtual opening and closing ceremony along with kidneyoki and other activities. Participants from across Canada are all invited to make videos or take pictures of your 100-kilometer journey. At our closing ceremony, we will have a video and song to pull all of these special memories together. You are all going to contribute to making our 2020 Kidney March video. I know you will all rise to the occasion. Our team is here to support you every step of the way. The Kidney March community and family are strong and committed. Let everyone know what you are doing, and the support will come in. I look forward to chatting with all of you over the phone or meeting you virtually over the next 4 months. Take good care. Failure is not an option. And now I'd like to introduce you to Heather Dean, who is a frontline registered nurse and 11-time Kidney Marcher. Bye for now, everybody.
Hi everyone. This year will be my 11th Kidney March. I've walked 1,000 kilometers. With the pandemic rules to keep us all safe, Kidney March will look different this year. Am I disappointed? Absolutely. I spent a few days, okay, maybe more than a few, feeling sorry for myself. I was focusing on how much I was going to miss my Kidney March weekend with my family and friends. I had to remind myself that my patients have faced many, many setbacks. They pick themselves up, they create a new normal. I need to learn from their example. I then asked myself, why do I participate in Kidney March each year? It's to raise funds and awareness for people living with kidney disease. Is a pandemic going to stop me from doing that? No. My focus is now on creating a plan to walk the 100 kilometers over 3 days in September. Same walking partners, Janice, Brenda, Mo, and Sandra. My same crew, Chris, Shane, Tim, Mark, Callan, and Kayla. Great food, a fire pit, and of course camping. We can do that. Cheering stations? Why not? Video, pictures, check, check. I even plan to walk by and check in on some of my corporate sponsors who have supported us every step of the way. What a fantastic Kidney March video we could create with footage from across Canada. Maybe we could take a selfie and create a 2020 poster. I'm sure if we all brainstorm, we can come up with some amazing ideas to make Kidney March 2020 one to remember. So how do we fundraise when people have lost their jobs, the stock market has more highs and lows than a roller coaster, and the future is at best uncertain? I asked myself the same question. I kept to the plan that has worked for me for the last 10 kidney marches. I sent out my email, including my pandemic plan. 48 hours later, I doubled my funds and reached my goal. People are looking for ways to make a difference. Kidney March is one way to do just that. Our Kidney March family has a lot of dedicated sponsors. Do not be afraid to ask. Do not underestimate the generosity of people. Let's all remember, failure is not an option. Bye for now.
Welcome to Kidney Plugged In, where we've got you covered for COVID. In this time of COVID-19, it is more important than ever to take care of ourselves. Here are some easy ideas to get you started. Eat well-balanced meals. Contact family or friends virtually, by phone, or even snail mail. How about meditate, even for 2 minutes? Create a gratitude journal. Practice deep breathing. Listen to your favorite music. Increase your physical activity. A healthy body leads to a healthy mind. Limit upsetting media coverage. Do something kind. Get outdoors and spend time in nature. Dance, dance, dance. Create a new recipe. Read a book, or even 2. We're plugged in, and we've got you covered for COVID.
COVID has hit us all hard. Unfortunately, with kidney patients, it's affected them as well. In our case, what we have discovered is allowing our bubbles to take a little longer to be extended, whether it's as her caregiver. My bubble of friends had to wait, whether we did walks 6 feet apart at the beginning. Now we can extend that to actually having dinner ordered in. In regards to Ava, what it meant was same thing, going on walks, FaceTiming her friends, but at this point, she's now extended her bubble to 2 different friends. So we'll continue that, and if health proceeds as it is, if COVID proceeds as it is, knock wood, then we'll open the bubble up to maybe another friend or 2 as time goes on. In regards to COVID-19 and kidney clinic visits, especially at children's, they are extremely strict with their protocols. There's one entrance in and out of children's that you have to check in. They ask questions, they check your temperature. At the once-a-month clinic visits that Ava has, we experience that one parent is able to be there with her. The other person has to FaceTime in, so we've taken turns to that happening. And what we've also experienced is that every other month they'll do a virtual appointment. So we're able to stay home and they're able to all Zoom in and able to ask her questions and experience things virtually, and then in person the next month, and so on. One of the biggest challenges through COVID-19 and transplantation was the understanding of how it would affect Ava and her schooling. As it stands now, without the transplant happening yet, then what will happen is Ava will be able to go to school in the fall, as whatever that looks like for all of the kids in BC. Unfortunately, if the transplant happens, then Ava will need to wait until there's a vaccine to attend school again, whenever that happens. COVID-19 hasn't affected Ava's dialysis, but what it has affected is the delivery for Baxter, which provides the dialysis supplies. In the past, they were able to deliver all the supplies into our 2-floor townhouse, straight up the stairs, and took them about 10 minutes. Now they're able to deliver right inside our front door, and then it's up to me to take the boxes up the stairs one at a time. I really appreciate getting the steps in. However, what's in each Baxter box is 2 5-liter bags of dialysis solution. So that's equivalent to about 20 to 25 pounds. And there's about 40 to 45 of those boxes delivered every month and a half. That's a challenge to get them up the stairs. So it's a good workout for me.
The Kidney March celebrated its 10th anniversary in September of 2019. And to celebrate this amazing milestone, participants from across BC and the Yukon joined together to participate in this epic event and became known as Team Because YuKan. And believe it or not, Team Because YuKan in their first year raised $75,000, well exceeding their original fundraising goal of $50,000. Pia and Marie were on hand at the Kidney March alumni reunion and celebration in Calgary last October, and they proudly accepted the 3rd highest fundraising team award on behalf of Team Because YuKan. What an incredible accomplishment. And that was just the beginning. Team Because YuKan is taking part in the 2020 Kidney March this September, a 100-kilometer journey. But this is more than just a walk. This is big. Team Because YuKan are joining hundreds in a united front against kidney disease. The Kidney March isn't easy. Members of Team Because YuKan are training for months to achieve the 100 kilometers and to raise the most funds they've ever have for this cause. But you know, they can't do it alone, and they need your fundraising support. So how can you help? Well, there's still time to register for Team Because YuKan, or donate to the team and help them take up the torch on behalf of millions that are affected or at risk of kidney disease. A kidney crisis is looming, and failure is not an option. So please visit kidneymarch.ca today for more information on ways you can help.
We're plugged in, and we've got you covered for COVID. So what is the best way to clean and dispose of used masks? Commercial masks should not be cleaned and reused because putting surgical masks in the washing machine may damage the protective layers in the masks, reducing their effectiveness. If you are sick or caring for someone who is sick, masks need to be changed frequently. All masks should be changed if wet or visibly soiled. A wet mask should not be used for an extended period of time. To dispose of masks after use, wash your hands with soap and water before taking off your mask. Never dispose of your masks or disposable wipes by flushing them down the toilet. This can cause backup in the city sewer system. Instead, dispose of used masks, disposable wipes, and gloves in a wastebasket lined with a plastic bag. After taking off your mask, wash your hands again with soap and water before touching your face or doing anything else. When emptying waste baskets, take care not to touch used masks or tissues with your hands. Clean your hands with soap and water after emptying the waste basket. All waste can go in the regular garbage bins. Remember that homemade or cloth masks should be cleaned and changed often. Do so by washing it using the directions on the original material, but in general, warmer water is better. Do not shake dirty masks to minimize spreading of germs and particles through the air. If dirty cloth masks have been in contact with someone who is sick, they can still be washed with other people's laundry. Any damage, fabric breakdown, or change in fit will reduce the already limited protection of cloth masks. We're Kidney Plugged In, and we've got you covered for COVID.
Hey honey, I lost the list for Jason's birthday thing. Obviously hamburger, cakes. No, not hamburger cakes. Hamburgers and cake. And buns, sausage.
Talking. Ooh, eye candy.
Is it a full moon tonight? People are being weird. And don't forget to make the Facebook event private this time. Okay, bye.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.